As a part of this IDLCC program, we as a group and I as an independent consultant deal with upper digestive system disorders, including hiatal hernia repairs, Nissen fundoplications, and then esophageal surgeries. And more importantly, as a part of this IDLCC, we also deal with bariatric procedures, which involves right from sleeve gastrectomies to gastric bypass, mini gastric bypass. As a comprehensive program, we evaluate the patients extensively prior to surgery and then schedule them for surgery. The surgery as such is a simple surgery if it is a planned one. The patients walk back home the very next day or in a matter of 2 days. In bariatric surgery especially, the patients are up and about on the same day after surgery and start consuming liquids on the same day, and then following which they also would have to be at a regular follow-up. That's the most important segment of this bariatric program. It's not just that they get the surgery done and then off they go and be on their own. They have to be on a regular follow-up for at least 1 year, and they will need regular vitamin supplements. The surgery as such is not a complex one, but it has to be done under a great deal of diligence. In addition to bariatric, as I told, we also deal with surgeries involving the upper digestive tract, like the Nissen fundoplication, hiatal hernia repairs, wherein we do these repairs under a laparoscopic technique, as we deal the same thing with the bariatric procedure. Laparoscopic technique as such is also called as minimally invasive surgery, wherein we put puncture holes into the abdomen, about 4 or 5 holes, and then using long instruments we introduce a camera and connect it to the monitor, and we look at the monitor and operate. If we see the olden days, there were long cuts right from the center of the chest up to the belly button, and the surgery used to be a complex one. The patients used to be at rest, admitted for at least about a week to 10 days. But with the advent of bariatric surgery, there has been a great deal of difference right from the cosmetic effect, wherein there will be very small scars, to the recovery of the patient and also resuming their work. In addition, with Nissen fundoplication and hiatal hernia repair, if the patient also needs surgeries for the gallbladder, we also address these issues at the same time. Gallbladder surgery also is a boon actually with the laparoscopic, it's called laparoscopic cholecystectomy, wherein we put 4 puncture holes and remove the gallbladder. We have been dealing with extensive complex gallbladder issues, and so also redo bypass surgeries in bariatric surgery. It's also called a metabolic surgery. In addition, we also deal with complex ventral hernia repairs, and in addition to the hiatal hernia repair, we can address issues pertaining to the stomach. If there is a lesion or a growth within the stomach, we tend to do a sleeve resection laparoscopically. We are also concerned in taking care of patients with pancreatic disorders and also complex biliary tract disorders.